This afternoon by praising Washingtonians who are doing so much great work in this effort against the COVID-19 virus. I spoke to the Undersecretary of the U.S. Department of Health and Human Services yesterday, who is praising our efforts in improving our testing capability. Dr. Birx, who has repeatedly recognized our efforts in bending the curve down because of our social distancing endeavors. We continue to see Washingtonians all over the state really putting their shoulder to the wheel and honoring the stay home, stay healthy order. There's just a lot of good things being done by Washingtonians, and it is having a beneficial impact in our state. And we do want to, as soon as we can, transition. And I want to talk about that transition that we need to get to when we can. And that is a transition from the social distancing strategy that we now are engaged in to an effort involving individualized, smart, targeted efforts to diagnose and recognize and protect and isolate individuals who have this disease and might transmit this disease. This would be a major transition from what you might think of as our sort of dull-bladed effort where everyone has to be involved in social distancing to a much more targeted position where we can wrap around protective bubble, if you will, around those that may end up being infected in the future. And that is a transition to be made when two things exist, and they have to exist together. First, our social distancing has to be successful enough that we drive down the number of infected people where we can be confident that we're not going to have the curve start to rebound and go up again because of the number of people who would then be infected. So our social distancing effort has to be successful to a given level to reduce the number of people that actually are actively infected in the state of Washington. That then sets the stage for the second stage of this effort, which is the individualized effort, where we test people rapidly, where we isolate them rapidly, where we treat them rapidly. And you might think of this as, to get to that second stage, we need to build the equivalent of a fire brigade. You know, when your house is on fire, you call the fire department, and they come very, very rapidly. We need the same type of response from a COVID fire brigade, if you think of it in those terms, where a person with symptoms can call, get tested immediately, be isolated immediately, and we can contact trace, go to all the people that they've contacted who potentially could have had the virus transmitted to them. And that takes a lot of legwork and potentially some new technology where we recognize rights of privacy and the like. The point is, as we're reaching this point of transition, we have to have both success of our social distancing we now are involved in to drive the numbers down, and this new sort of fire brigade approach to test people very rapidly and isolate them very rapidly. And both those things have to exist before we can push the go button for this true transition. So I wanted to share with you some of the information we have, the data that is helping us figure out when that transition can take place. As you know, we've been making decisions based on science and data in our state, and it has served us very well. We are a very technologically oriented state. I think that's one of the reasons we've had considerable success bending the curve down now, because our people in Washington accept data and science and make decisions based on logic and data and science. We want to continue that pattern. So I wanted to show you some graphs of some of the modeling that we've seen that could look at our historical rates of infection and what we might see in the future. This is a graph from the Institute of Health Metrics and Evaluation at the University of Washington. And this basically shows, starting in March, moving over to August in the right. And this shows the deaths per day that we have experienced in the state of Washington. You'll see that the numbers, unfortunately, of our tragedies have gone up. And of course, they vary from day to day, up to about this chart goes to April 8th. So we see what we've already experienced on the left of these graphs, and we are now about in this range here on the 15th of April. And what this chart shows is a hopeful reduction of the rate of transmission and fatalities going down in this dotted line. That is a potential curve if everything goes right, if our social distancing continues, if we continue our efforts. There is a possibility that this curve could continue to go down according to this particular modeling agency, which the world has been watching very carefully. So we would certainly hope that would be the case. I'd like to show you a second graph from the same institute that builds on the first model. This is essentially the first model, but it demonstrates what the modelers have suggested will happen if we in fact abandon our social distancing strategies. So you see on the left the history of the deaths per day and the potential curve going down if we continue our social distancing. But if we stopped our social distancing on April 10th, which is at this point, that curve would start to go up again, and that means additional deaths in the state of Washington. If we stopped our social distancing on April 22nd, you get this preventable death in the dark blue curve. In either case, we have potential increased death in the state of Washington. And what this demonstrates is that we have to remain committed for some period of time to this social distancing strategy. Now, this is somewhat of a blunt instrument, but it is effective because it is, we believe, bending the curve relative to what other states have experienced. Heart goes out to the people of New York who've seen hundreds of people lose their lives a day, and Louisiana and Detroit where they've had much more difficulty slowing down this infection. So it can be effective, it is effective, but it needs to continue if we are going to drive the numbers down to a region where it might be safe to take some of these measures off. Now, I'll show you another graph from a different modeling agency, or excuse me, it's the same agency. This shows the curve of what's called R naught. Basically, it's an estimate of how many people are infected if one person has the disease. And this shows the estimates of the Institute for Snohomish, King, and Pierce County of the three lines. Starting early in the transmission, the curve starts on February 28th and goes down to March 23rd. You'll see that these start at a number of about 3. And what that means is for every person that's infected, when this infection pandemic started, every person infected in those 3 counties basically would infect 3 more people. Very, very dangerous. And that's why we were having such spikes in the numbers of fatalities. Over time, because of some of the work we've been doing together as a community, that number has gone down. So now it is in the region of 1. This is a line that shows 1, meaning for every infected person, they infect only 1 person instead of 3. So you can see in those 3 counties, we've made some real progress on the rate of infection. That's good news. These curves show that what we're doing works, and it shows that we can be in control of our own destiny if, in fact, we remain committed to it. But I'd like to show you a fourth graph now. And I'm going to take just a moment. This is a little complicated, but I think it's an important one to look at. This is from a different agency, the Institute for Disease Modeling, also here in Seattle. This basically takes some historical data and then looks at what the projected number of cases and the acceleration will be and could be depending on what we do on social distancing. And you'll see these dots here basically are data points, with this green curve being the historical curve up to about April 2nd. This line here represents April 2nd. You'll see that the numbers were going up, and the good news is the rate of increase started to level off here. was not as steep, started to level off. Our social distancing has reduced the rate of infection. And this starts to level off as to the fatalities per day. There's two concerns about this graph that we need to be aware of. Number one, this model suggests that this rate is not going down at the moment. It's plateaued. It's level. And that's not as good as we need, because it means we would continue to experience the infections and fatalities we are having today. We lost 30 Washingtonians the day before yesterday. I believe 21 yesterday. Each one of these is a tragedy in a family. It's unacceptable to us. So this model suggests that we need to do more to be able to bend this curve so that it goes down and we reduce the number of fatalities. And that, for that reason, we're not out of the woods yet. Now, this graph also has this disturbing information. They also graphed what would happen if we took off our social distancing right now. And that's represented by this line here, that if we took off our social distancing a week or so ago, this number would start to go up. Our fatalities would go up rather steeply and continue going up until some other intervention occurred. The combination of these models, and of course, predicting the future is tough, they both show several things. Number one, we have had some success with our social distancing. The efforts of people that are so difficult are having a positive impact. Number two, we're not at a level where we can take off social distancing, nor are we extremely close to a level where we can take off social distancing. And number three, if we do take off social distancing, we are going to see a rebounding of this virus and more fatalities even than we are experiencing today. So the combination of these things show that we ought to be confident in our efforts. We ought to be able to realize we can control our own destiny, that we are not simply passive victims of this virus. There are things we can do to fight back successfully against it, but that we have a lot more work to do until we can get to this transition point. So we are working towards that transition point. We're working towards it every day. We are expanding our testing and our capacity to help people to realize if they have the disease. We are protecting our most vulnerable people. Yesterday I issued what might be the first rule in the United States to protect people over the age of 65 at work. We are making sure that our hospitals have enough surge capacity to deal with this virus if in fact it does grow rapidly, and we're maintaining a good cushion in our hospital capacity. We are continuing our research. The Gates Foundation and others are doing some tremendous research right now, cutting-edge research, even clinical trials on some medical processes. We are thinking about the way to increase our safety in our businesses and our schools as we go through this transition. So where we are today is we're not at that transition point. I wish I could tell you when that transition point will be, but I know this. We want it to come as fast as possible. We know the order is in place at least through May 4th, and we know that the more work we do today, the faster that transition point is going to come tomorrow in the days to come, and that's why I'm pleased that so many people are honoring this order to stay home and stay healthy. I want to mention a couple other things that I'm hopeful that people can think about. We've unfortunately, because we've had so much job loss in our state, we've had an increasing number of people who do not have health insurance. And I want those folks to know that we care about you in this situation. We're glad that we have health care reform in this state, and we hope that you'll look at using that health care reform. If you are without health insurance or you're worried about your health insurance, you can go to wahealthplanfinder.org. That's W-A, healthplanfinder.org, and check out your options to get health insurance through these measures. We hope that this will help you get through these troubled times. I want to close on a couple notes. Number one, I'm glad that our state is still working together I'm glad that we're using our constitutional authority to make these tough but important decisions. I'm glad that the President has recognized that these are decisions for us to make in the state of Washington, not in Washington, D.C. I heard the other day that he said that he was going to authorize the governors to take certain steps. Well, we actually have authorization. That comes from the U.S. Constitution and our Constitution, and we will be fully protective of that. So we're having some good working relationships with federal agencies. We're very appreciative of the Public Health Service. They now have doctors helping us in strike teams to go in and help our long-term care facilities maintain the best infection control possible. They're helping us continue in our effort to get test kits. So we're getting some good work with the federal government, and we trust that's going to continue. I'll just close on this note. I know people are experiencing the stress and anxiety that we all feel to some degree, and I know we've all been inspired by acts of kindness and compassion and empathy when neighbors help neighbors and business people keep paying their employees, and untold acts of kindness. But I want to point out it's a good time not only to give help, but to be willing to ask for help too. And maybe you're a person of some age that would rather not go to the grocery store right now. Don't be shy about asking the teenager next door to do your shopping for you. They got some extra time on their hands right now. And we hope everybody is willing to not only offer help, but to ask for it as appropriate. With that, I'm happy to stand for questions.
Okay. First question, we're going to go to Rachel with AC. Governor, Secretary Weissman said yesterday that our new normal will be that general distancing and masks and not shaking hands and that sort of thing could continue for many, many months, even after we hit a transition point and restrictions start to lift. Do you agree with that assessment? And another question is that he also suggested an incremental approach of reopening various things may need to occur. So I want to know what you think that might look like, and if you could give us any examples of parts of the economy may open first and when.
Well, I think that this transition will not be a light switch on and off. It will be a dial, and we will dial it up and down as the data suggests and as our community responds. And it will be a phased approach. The phasing will be probably the reverse of what it was going into the effort. We started by prohibiting large gatherings. We then closed on-site education in our schools. We then had a stay-home order in our individual lives. We then closed non-essential businesses. And as we come out of this, we presume that that will be in inverse order as we come out of this, as we open up some of our economy and our personal lives. And that makes sense because we'll be bringing back the things that are most essential to our economic and physical and financial health, and then working out to the periphery of things that might be maybe some of the most joyful things in life, but maybe not the most necessary to maintain our household income and otherwise. So it'll be a phased approach. The pace of that will depend largely on the data of how this data responds to what we're doing. I was talking to a leader at Starbucks the other day, and if I may quote, I hope they've released this, that basically they have an approach of monitor and adapt. And I think that's a good way to look at this. We will monitor how each part of this dial is reflected in the data, and we will adapt depending on what we see as we move forward. As far as what John said, who's done a fantastic job, he and Kathy Lofi have just been invaluable state assets in this. I think they've made some really good calls and advice to me, and I just can't overstate how valuable they are to the state effort right now. And I think they're right that we will find some cultural and other differences in our personal habits for months going forward in this regard. And I think a lot of those things we won't find particularly intrusive. People might be relieved from having to shake hands with politicians here for some period of time, and they might find some relief in that regard in any event. So yes, I think there will be some changes, and we'll be able to live with them.
Next question comes from Joe with the Seattle Times.
Governor, other states are starting to require people to wear masks when they're outside and can't social distance, or when they're in grocery stores.